To mask or not to mask, and which mask is proven to be most effective? The Centers for Disease Control and Prevention is providing clarity on that second question. N95s and similar high filtration respirators offer the best protection against COVID, according to the CDC, while cloth masks provide the least protection. And joining us now with much more is Dr. Irfan Hafez, infectious disease specialist and chief medical officer of Northwestern Medicine McHenry, Huntley, and Woodstock hospitals. Dr. Hafez, thank you so much for joining us. So what exactly is the CDC saying with its new guidance on masks?
Really, I think the take-home point here is that Omicron spread is very serious. The infectivity that we're seeing is quite a bit, and therefore the initial recommendations of just using purely a cloth mask are probably not sufficient, especially when we're seeing this amount of infectivity there. And that's why in the guidance, they've really tried to push people away from cloth masks to multi-layered masks or masks with better filtration like surgical masks, or even going all the way up to N95 masks.
And you mentioned N95 masks. They're considered the gold standard. How so?
Well, we've been using them for decades. They are designed to remove 95% of particulate material from the air that you're inhaling there. We've used them for a long time for tuberculosis, other airborne illnesses as well. So we know they're very efficient.
And we've got all these different, we have N95, KN95, KF94. What are the differences between these types of masks?
Well, there are some subtle differences. The KN95 is more of an international designation. N95 is what we typically use in the United States. They're slightly different standards. We typically, especially at the hospital level, only use N95s when we're in the hospital.
And the blue surgical masks are the ones I most commonly see and the ones I most commonly use because they're the easiest to get. The CDC says they're, quote, an acceptable alternative for doctors and nurses when interacting with patients infected with coronavirus. Is there some controversy over designating those surgical masks as acceptable alternatives?
No, I do think that is. I think the N95s become quite cumbersome to use. They're difficult to breathe in sometimes when you're wearing them for long periods of time. However, if you are at high risk, if you're immunocompromised, or if you're working in an environment where there's lots of people that may potentially be contagious, yes, an N95 would be appropriate in that situation. For most other situations, moving from a cloth mask to a surgical mask is probably more appropriate for most people.
In terms of the N95, it is hard to find. Is there a nationwide shortage, or is it just a matter of you just need to know where to look?
Well, there is a supply constraint around the N95s. They're a little more harder to manufacture, so they are in more limited supply. Plus, we're trying to use a lot of these at the hospitals where they're most needed as well to protect our healthcare workers.
And as with a lot of things, there might be bad actors trying to sell a product. So how does a consumer know what a legitimate N95 or respirator mask is versus something that isn't quite legitimate?
Yeah, and that is a good question. You do want to look for certification, NIOSH certification on the box, and it's usually imprinted on the masks themselves. There are some reports that up to 60% of KN95 masks don't meet standards, so that is something to be wary of.
And what about the reuse of N95? There's been a lot of talk in recent days about that. Are they safe for reuse, and what is the best way to reuse them?
So when we do have constraints in supply, reusing of the masks, both surgical masks and N95s can be done if they are done properly. But you don't want to be touching them constantly throughout the day. You're wearing them. At the end of the day, if you take them off, put them in a brown paper like a lunch bag. That is something that can be done, and you can use them for a few days. Once the mask's surface becomes either worn or torn or wet, definitely cannot use them at that point, and you must use a new mask at that point.
And back to the CDC official guidance now on cloth masks. I mean, is this something that had been known for a while among health experts, that these cloth masks really aren't particularly effective in stopping, especially something like Omicron, as contagious as that?
Yeah, I think there's two functions there. One is the infectivity of Omicron. So yes, it's more contagious, but also when we have such widespread disease present, the number of points that you may be exposed to also is high. And therefore, the cloth masks, which may have been fine 6 months or even a year ago, are probably less effective at this point. So in order to protect, we do have to elevate the amount of protection by going at least to a surgical mask.
Is there a different guidance when it comes to masks for children?
Yeah, for children, it's hard to breathe through these respirators, and it's very hard to find the right size for children. So sizing is really important when you get to the N95 respirators. So you have to have one that fits your face correctly. If you have facial hair, it may not fit. If you're a child, it may not fit as well. In that case, the surgical masks are probably better, and you want to use the ones that have the little bit of wire around the nose so you can kind of press down and actually have it conform to the face and reduce any air leaks around the sides. That's what's really important.
All right, a lot of useful advice, and our thanks to Dr. Irfan Hafez. Thank you so much for joining us.
Thank you for having me.